Today with me, in addition to Dr. Alex Biu, who's always here with me, we also have Secretary Courtney Phillips of the Department of Health and Dr. Jimmy Guidry of the Office of Public Health. Dr. Phillips will deliver some remarks once I complete mine. Before I begin, I just want to take a moment to acknowledge that today marks 10 years since the Deepwater Horizon disaster and the beginning of the BP oil spill. Today we remember the 11 men who tragically lost their lives that day, and we continue to pray for their families. A decade later, our coast is still recovering, but it's important to note the tremendous strides forward that we've made during that time with coastal restoration and protection programs and other programs to improve the coast for the 2.5 million people who live and work along coastal Louisiana. It reminds us that the people of Louisiana are, in fact, very resilient, which is why I'm confident that we're going to get through this current public health emergency dealing with COVID-19. You know, there were a lot of heroes who responded to the BP oil spill and to that explosion 10 years ago. Today we're seeing similar acts of heroism from our healthcare workers, from our EMTs, first responders, and we just simply cannot say thank you enough to those individuals and for the contributions that they are making. For the test results today, we are reporting 595 new cases for a total of 24,523. That number is up from yesterday. I'll remind you that on Sunday we don't typically see a lot of activity in terms of testing numbers and so forth, and so that's what we're reporting from yesterday, and you have to look at several days to try to figure out what the trend over several days actually is. It is the highest increase, however, in deaths that we've reported in more than a week. The 500, I'm sorry, not deaths, highest increase in cases that we've reported in more than a week. And so we have to continue to watch that number, especially as we try to figure out where we are in meeting the threshold requirements to move into phase one. And we'll talk a little more about that later. Sadly, there are 32 new deaths to report, which brings us to a total of 1,328. Obviously, these are our brothers and sisters, as we've talked about before, and we grieve every single one of them. And I'd like the families of those lost in the BP oil spill and that explosion, we encourage you to lift all these people up in prayer as well. But that number of deaths is actually down. Again, we don't make too much of it, both because it's one day and because it comes on Monday after a Sunday. But we're watching that number very carefully as well. There are 1,795 COVID patients currently hospitalized. That is a very slight increase from the previous 24-hour reporting period, with 332 of those on ventilators. So we're going to continue to watch all these numbers, but it is clear to say that over the last 7 days, we've seen a decrease in the number of people in the hospital, which again lets us know that we are trending in the right direction. Earlier today, I was on a call with the Vice President. It was a video telephone conference, and a number of governors were on. We relayed all of these numbers to him on that call because they had just come in as we were doing that video telephone conference. The conference call this morning was focused almost exclusively on testing and the important role that testing is going to play going forward, both diagnostic testing and the antibody testing. And so that's what you're going to hear a lot of discussion about at the national and state level going forward, and you're going to hear me talking about that over the coming days and weeks. We are moving to more parish-focused data on the Department of Health dashboard, and as a result, you're going to see a pause in some of the reporting. I know, for example, as it relates to commercial tests, just so we can get the detail that we're looking for, so that the public have a better idea what's happening at the parish level. So we're not going to be reporting those commercial tests every day until after we get through this transition, and then we'll go back to the complete daily reporting that you have been accustomed to seeing now for some time. I think we expect to have these changes done by Wednesday, Thursday,
End of the week, sir.
by the end of the week, and then we'll get back to the kind of reporting that you've grown accustomed to. As far as testing is concerned, we're proud of the amount of testing that we've been able to accomplish here in Louisiana, but we still know more needs to be done, because testing is the key to identifying people with COVID-19 and isolating them, but also doing the contact tracing necessary to identify people with whom they came into contact with from a period that goes back about 48 hours or so before they ever became symptomatic. And then you not only contact those individuals, but you try to get those individuals into isolation, quarantine as well. That's the key to reopening the economy without seeing cases surge. That's why it's so critically important. We have to do as much as we can in the areas of testing and contact tracing to make sure that we prevent cases from spiking as we move forward. As it relates to reopening, we are hopeful that we're going to meet the requirements for phase one sooner than later. Remember, there are some threshold requirements that have to be met, and you measure 3 different areas over a 14-day time period to make sure that you're moving in the right directions on each of those. And so we haven't met that threshold yet, but we're also not at the end of the current stay-at-home order. And so I'm hopeful that we will continue to move in the direction that we've been moving, and we will meet the threshold. But what we are announcing today is that we are going to issue a new order out of the Department of Health, and this relates to non-emergency medical and surgical procedures, and it will be effective 1 week from today on Monday, April the 27th. The revised guidelines will state that medical and surgical procedures shall only be performed under the following conditions. One is to treat an emergency medical condition. Another is to avoid further harms from an underlying condition or disease. And thirdly, for time-sensitive conditions. So this will also apply to dental visits, procedures, and surgeries, and they will be performed under the same conditions. So this will have the effect of opening up more optional elective type procedures, non-emergency procedures, both in the hospital setting and in the clinical setting. As we told you last week, it was our intention to do, because we believe we need to allow people to resume going to the doctor for things that may not be an emergency, or at least not at first, but if you don't allow them to get treatment, then at some point many of those things will become acute and emergencies. So we want to make sure that we do that, and we do that in a way that's safe and that still controls the spread of COVID-19 and so forth. So before facilities can perform any of these procedures, each is going to have a plan in place to monitor for COVID-19 symptoms, to test if possible the individuals coming in, to ensure adequate physical distancing between patients. They're going to have a minimum of 5-day supply of PPE available to them, and then they'll have to follow additional guidance that will be outlined in the order. If telemedicine can be performed for that particular visit, we're going to continue to encourage that they do those visits by telehealth. Again, we're still trying to minimize social contact and eliminate unnecessary travel in order to reduce the spread. I would remind everybody that there are 10 days left in the President's 30-day period to stop the spread. There are also 10 days left in my order with respect to staying at home. It is critically important that we continue to comply with that order, that we continue to maintain our physical distancing when you do get out of the home, at least 6 feet between you and others. And if you're going to be in close proximity to others, wear a mask. That is a CDC recommendation. Also want to make sure that you follow proper hygiene practices as well. I am now going to turn it over to Dr. Phillips, but before I do so, I want to thank Steve Russo because he was the acting secretary of the Department of Health for some period of time. And although it wasn't that long, it was very eventful and very challenging. And Steve Russo did a great job as the secretary of the Department of Health, again, under very difficult circumstances. But we as a state are very privileged and blessed to have Dr. Courtney Phillips, who is now the Secretary of Health. She's here for her first briefing today, and then she'll come up and have some prepared remarks. I would ask that if you have questions for her about the Department of Health, that you raise those while she's up here at the podium, and then I'll come back. We'll take a couple of questions from the public, and then I'll get to your questions as well. Dr. Phillips?
Thank you, Governor. It is definitely an unprecedented time for me to join the agency, but I must admit that I'm extremely grateful and respectful for this opportunity to join LDH. It's the first time in a long time that I'm able to say that I'm here to serve my home state, and it's just wonderful to be here. And I know that this is a trying time for all of us. It's a very different time. We don't know what's ahead of us, but I must say that the leadership the governor and his extended team has provided should give comfort to our area. We know that the department is committed to serving and putting forth the effort needed to make sure our state is safe. The work that LDH has done, we are committed to continuing to do that work. The information that we're putting out, we're trying to put out as quickly as possible. As the governor said, we want to continue to refine those efforts and that information. And so at some point, we do have to take a hold and continue to refine that information. But we want to make sure we're getting out the word as quickly as possible so you all understand where we are and where we're headed. One of the new features that you'll see on the LDH website on that dashboard is a heat map. And that'll show what cases have been reported to us by census tract information. So it allows the public to be interactive so they understand where cases are being reported to us. It also gives the department an opportunity to understand where we may need more testing, particularly by those census tract areas. As the governor said, today he announced a lifting of time-sensitive procedures. And it's important for us to understand this and to move forward to get the services that individuals need. But the public also must recognize this is not a lifting of everything. And so in order for us to be successful as a state, it's not just dependent on us here today, but it's for everyone. So this is a time that the public can also serve as a public servant and do their part in terms of keeping us all safe. One of the things that brings me to Louisiana and back and being excited is that I know who we are as a state. We are resilient, we know how to rise up, and we know how to band together. And so this is a time for us to band together and keep one another safe by following the governor's orders. The success that we have seen thus far in terms of us flattening the curve is because of each one of you. And we ask that you continue those efforts and following the governor's orders. Each day he lets you know where we are, what we're doing, what we need to continue to do to keep each other safe. And that is relying upon us to do our part. And so thank you to all the healthcare workers who are serving us, those store and warehouse workers who continue to provide the necessary goods, but also to each of you who has followed the governor's orders, has done your part to keep us successful. And we want to keep on that strive. As we continue to lift things, we want to make sure that people are following those orders. Again, our success as a state is dependent upon each one of us, and we ask that you continue to do your part. So thank you for the opportunity to serve Louisiana and allowing me to be here. Thank you, Governor.
Do I have any questions for Secretary Phillips?
Can you explain exactly what the order for non-elective medical procedures does and does not allow?
Yes, I'm going to ask Dr. Gidger to come up to do that.
There are many medical procedures that have been postponed, that medical professionals have chosen to postpone to get us through this curve that we're working on. And these procedures that we're talking about are time sensitive in the fact that the longer you wait, the worse the condition might get. So anything that would make their condition worse by waiting any longer is what we're trying to lift right now. So those procedures, those surgical procedures that have to do with any medical condition that gets worse with time, we're concerned because when you look at the data and you look at medical data right now, we're seeing where heart attacks and strokes are decreasing from what we've seen in the past. And our concern is that people are so worried about corona, they're not coming in for their medical care. So our hope is to get people in for their medical care so that we can deal with the things that may be worse than the corona. You know, the things that having a stroke and having the morbidity from a stroke, if you're not coming in, that's actually worse for some people than dealing with corona. So it's all those procedures which have been postponed now for a month, bringing them back online so that people don't delay getting the care that they need.
Sorry, it's all the procedures that were delayed, or it's all the ones delayed that have to do with time-sensitive?
All procedures which are considered time sensitive, and the medical professionals who do this every day will decide what are those procedures and who are those patients that need to come in, and they'll be contacting them and scheduling those procedures. So each specialty will decide what are those things that can no longer wait that need to happen now. And we also are saying that anything that can continue to be postponed without putting the patient at risk should also continue to be postponed.
Can you give just a few examples, Dr. Guidry, of what time sensitive that you're talking about?
Right now, when you talk about doing outpatient surgery or inpatient surgery, it depends on, are they putting off getting some kind of ENT work? So you can start thinking, is there some lump or bump that needs to be removed to decide if it's cancer? Putting it off longer means that cancer, if it is cancer, is having an opportunity to grow. So any procedure that is diagnostic or actually makes your condition better, so that could be ENT surgery, that could be thyroid surgery, that could be heart surgery, all those things that we've delayed now for 30 days. If the patient's condition is getting worse, we need to get them in and get those procedures done.
Including, I think the governor mentioned some dental procedures.
Dental as well. When you think about dental, it's certainly something that people say, well, what's critical? When you're fixing cavities and you're doing things to teeth that keep infection out, abscess, root canal, you're fighting infection. If you let that go on for too long, that infection is actually close to your brain. So you have to worry about those infections spreading to areas which are worse in your bloodstream, in your brain. So literally getting those procedures done that prevent from getting worse, because what worse means is a poorer outcome. So which is worse, the risk of getting corona? Well, we can do things to mitigate that risk. We can take temperatures. We can do things to keep people from congregating in waiting offices. So there are things we can do to mitigate that risk, at the same time removing the risk from the things that they're correcting.
How does this affect abortion clinics?
That is a question which, at this point, we're still evaluating, and it's a question of that's a surgery for some folks that can be life-threatening, and some folks is elective. So that is not a question that's easily answered, and it has to do with medical and philosophical. From a medical perspective, there's a timeline when you can do these without putting the mother at risk, but there's also an argument about what's the age of the fetus and what does that mean for the fetus. And that's not an argument that medical professionals tend to get into, but at the same time, those procedures can be considered time sensitive.
So some abortions are still allowed if they have to do with the life of the mother, you're saying?
At this point, the abortions that are being looked at by those professionals that do them, it would be decided whether it's time sensitive or not.
So time sensitive could mean you're approaching the law, the time where it's illegal to have a certain time within the pregnancy.
Correct. When you talk about time sensitive, there's a legal time when you can do it, when an abortion can occur, and that from a medical perspective. So from a medical perspective, that it's time sensitive. Once you pass that date, you can't do that. It's illegal.
A question for the secretary. Are you looking at LDH of hiring more people to do the contact tracing that you're talking about? I mean, it seems like you would need an army of workers to do the level of detailed work that goes into that kind of tracing. So is that something where you're
Yeah, we are exploring that right now. We're looking at what level of staff, contract staff, what staff do we have internally, and looking at multiple levels, not just the epi level, but what's that middle level. Also, could the possibility of using call center workers. So we are exploring that possibility right now, and we'll be presenting a plan to the governor later this week.
Has anybody been hired now to do that work, or have people been repurposed to do that work?
We have had people that have been repurposed currently on the team. We do that work. We just have not done it to the level that's needed based on this particular pandemic, and that's what we're gearing up for. We are not to where we need to be. No state is, and that's what we're working towards.
How many of those people do we need?
what was the number? 700.
And how many do we have right now?
About 70.
70.
I know that this may be for you, Ram. We're talking about a lot of surgeries that would make their condition worse. Are we talking about anything like dermatologists or like plastic surgeons? How are you going to kind of differentiate between what exactly is an essential kind of surgery, possibly?
So the guidance is from CMS, from the federal government, and from us to let the professionals decide what are those things that cannot be postponed. You might think of removal of a bump in dermatology as non-essential, and it's elective. But if that's a cancerous growth, that's not elective. I think that the confusion is what is elective. Most people would not elect to have surgery. They usually have it for a purpose. It's usually to diagnose something, to remove something. And so literally you're leaving the medical professionals to decide, can I put this off? Is it worth bringing somebody in for a procedure, or should I put it off? And each professional has to make that decision, what's best for the patient.
For the government.
Yes, sir.
Oil and gas have tumbled today, and there are warnings that some people may actually halt operations in the oil and gas industry. What is your response to that?
Well, look, we're monitoring that very carefully, as is the rest of the country and the federal government as well. Obviously, an unwelcome sign at $20 a barrel, oil wasn't high enough to really do a lot for our economy anyway. And look, we're hopeful that the situation is going to stabilize and that it will right itself sooner than later. But these are events that are unfolding before our very eyes, and nobody has ever seen this before. And so I don't have any comments on it in specific, other than to say we obviously look forward to the day when oil will command the price that it ought to. So that we can have a vibrant industry here in Louisiana and the employment that goes along with that. Right now, that's not the case, and this is a problem for the world. It's not just a problem for Louisiana right now, but it adds to the challenges of our economy right now. There's no doubt about that. I mean, there's nothing positive. I guess there are some people that won't mind paying less for gas, but for a state like Louisiana, that trade-off is not a good one for us in terms of employment and in terms of the economic impact. I did want to get back to the order. The reason the order is being issued today, effective for a week from now, is so that procedures can be scheduled. Those doctors can look at their patients and decide which ones they need to schedule. They have an opportunity to get their staff scheduled. They can clean their facilities. They can get the PPE, and if they have questions, they can then direct those questions to the Department of Health. And there's already been a lot of work that's taken place between the Department of Health and various medical providers before today to kind of work through what this order would look like. I know it's for specifically some of our larger hospitals who are on the front lines of the COVID-19 fight had an opportunity to do that. But that's why it's being issued today and effective a week from now. So we've got a question from Susan, who's from Monroe, and she says, my hours were cut due to COVID-19. I filed an unemployment claim and file weekly, but I make more than my weekly benefit. Will I qualify for any of the federal benefit of $600 per week? So generally speaking, if you've had your hours reduced or you're mandated to stay home by your employer, you could be eligible for the additional $600 weekly unemployment benefit. There are certain monetary and weekly eligibility criteria that you have to satisfy if you're going to be eligible. It's important to note that you're going to be required to report your weekly gross wages to determine your eligibility, and you have to do that every week. So you have to recertify. If your gross wages are more than $247 per week, you won't be eligible for state benefits, and as a result, you won't be eligible for federal benefits. But I'm encouraging everybody to file a claim if they think that they might be entitled to benefits. Answer all the questions truthfully, and they will let you know whether you qualify or you don't. We further encourage people to apply at laworks.net, so that determination can be made. We still have a fairly large volume, not a fairly large, an extremely large volume of claims and weekly certifications being made. So if you can do that between 10 p.m. and 5 a.m., you'll be more successful. Chelsea and Hammond asked, when will other areas of the state get drive-through testing? That's a great question, and of course it's not as easy to stand those up as one might think. But we know how important testing is to beating this virus, and we've made tremendous strides here in the state with respect to drive-through testing. In fact, 3 of the first sites anywhere in the country were in Louisiana, 2 in New Orleans, 1 in Jefferson. Those were sponsored by the federal government. We executed them, and then the federal government withdrew, except FEMA continues to work on resupply, those are now state-run, one of which remains in Jefferson Parish at the Lario Center. The other 2 were relocated to the river parishes because we had hot spots there. But drive-through testing is important. We're trying to expand the capacity there. We're working with private providers like Walmart and Walgreens in order to do that. However, it is still true that the vast majority of testing in Louisiana continues to happen in fixed facilities where individuals go inside in order to be tested. Now, we continue to explore all options to expand testing across the state because, as I mentioned earlier, that's going to be key to making sure we're able to monitor the state and keep a lid on the cases and that they don't spike. And it also informs our decisions with respect to the contact tracing that is so critically important too. We keep a current list of all testing sites on the LDH website, so ldh.la.gov. ldh.la.gov is where people should go in order to take a look at that. So with that, I will take your questions. Greg.
Governor, do you have any plans? Are you considering reopening things by parish? I know you've been asked that by some of you.
No, I don't think trying to do it by parish is workable. I guess if you could potentially do things by region, but that's really not the direction that I'm intending to go right now. We haven't made any final decisions as of yet, but that the answer to your question is no. That's not under consideration. Yes, ma'am.
There were several Southern governors that had a regional conference call over the weekend in Alabama, Georgia, South Carolina, Florida, Tennessee, Mississippi. Were you invited on that call, and have you reached out to them if you weren't invited on that call to discuss things with them?
No, I wasn't, and I understand that that's going to be focused in the area that you just mentioned. Won't come as far west as Louisiana. I don't think it goes into North Carolina either, as I understand it. So it's not a call that I was invited to, or even aware of until earlier today.
Do you think that that's a partisan decision because it seems like the governors who were left out were Democrats?
No, I guess I choose not to think it's that. Because those are all contiguous states, and you're not going to get all 50 states to participate in a region, a regional decision about reopening, and at some point you have to have, a stop to that regional effort, and they chose to go as far as Mississippi. That's fine with me. Yes, sir.
Governor, you've indicated a couple times that we could meet the 14-day downward trajectory threshold by May 1st.
Mm-hmm.
Could you talk about what specifically, are we looking at just cases, or are we looking at hospitalizations and other indicators too? And also, assuming we do meet that, are we going to have enough testing capabilities, contact tracers, these other resources to in fact open?
Yeah, so those are great questions. And there are 3 different things that we're watching for to try to, and measuring over 14-day windows to make sure that we're on the proper trajectory on each one. And by the way, we don't believe that every single day you have to have a number that is better than the preceding day, but you have to be on, generally speaking, on a positive trend. The trajectory has to be good over the 14 days. One has to do with symptoms, and I think they call this syndromic. And I have to look at Alex every now and then because I get a little confused on this. But you have to have a 14 days of a downward trajectory on people reporting symptoms that are similar to COVID-19. Then you got to have a 14-day period of actual cases that are trending in the right direction, and then you've got to have 14 days. And when I say it's all in the same 14-day period, it's not over 42 days. And then you got to look at hospitalization capacity. So you got to look at your trend lines on all of those areas. We don't have, as I stand here and speak to you, 14 days where we meet the criteria, but we are trending well over the last week or so to get there. And I think we likely will if people continue to stay at home and practice their social distancing and their hygiene, and we continue to slow the spread and so forth, then we're likely to get there. Now, what I want everybody to understand is that phase one of a three-phased approach to reopening is what we're looking at. This came from the president's guidance. I think he issued it last Thursday. We had an opportunity to have a long conference call with them about it and so forth. But that phase one is not reopening the economy like flipping a light switch. And so we have to look at what that looks like, how many more people will be brought in contact with others, what we think what might happen with cases, and then what amount of testing we have to have in place at that point in order to make that happen. We're still going through that evaluation, and we haven't made any decisions. It is my expectation that several days ahead of May the 1st, you're going to have me walk you all through what's going to happen on May the 1st. I'm just not there yet. Like every governor that I know anything about, I very much desire to begin to reopen our economy. We didn't close it all down, obviously. There were a lot of businesses that were deemed essential and a lot of workers that were deemed essential and so forth. But there are a lot of small businesses out there and some that are not so small that have been closed. A lot of workers are at home. I want to reopen the economy as safe as we can, as quickly as we can do that, and protect public safety and save lives all at the same time. The testing is going to be a key component of that. And so we haven't made any determinations, but I want to do it obviously sooner than later, but striking the right balance. And that's about as definitive as I can be today. And Leo's about to ask me another question to get around and see if I'll get more specific. Leo?
Well, those pesky Harvard people are back at it. They came out with a study over the weekend that said that we're nowhere close to testing appropriately. We were testing about 150,000 people a day when the number should be closer to 500,000 to 700,000 a day, which is an impossible number. If we had the test and could do that, I'm sure we could. They did give Louisiana high marks in that we test 124 out of 100,000 people a day, only second behind Rhode Island. In comparison to Texas, which is only testing 27 people a day per 100,000. So they might be operating under what we don't know will hurt us operation. In our case, if the World Health Organization is saying we need to be down to about 10% testing to positive ratio, and New Orleans is still at 31%, do you really have any idea that in 10 days we could probably accomplish that and bring that down by 20 points?
Well, there are a lot of different metrics out there that are under consideration for when you can safely begin to reopen. Again, this is to begin to reopen. This isn't flipping a light switch and everything is back the way it was 3 months ago. And testing is a big part of that. And different people disagree on what that number looks like. I will tell you that we believe that in a month's time, we need to be able to test somewhere between 140 and 150,000 people here in Louisiana. Is that right?
We're going to try to overshoot that.
And that is a minimum number, so we actually are gearing up. We're making plans to test as many as 200,000 people per month. And we want to make sure we have that capacity in place, not just with respect to the labs, but with respect to the collection kits and everything that it takes in order to obtain that sample, get it to the lab, and have it tested quickly and in a way that's reliable. And so there's a lot more there than meets the eye, because some of these things are still a little bit hard to get. But we're working through that now. And all of this informs a decision about when you can move forward with that first phase of reopening. And so I'll ask Dr. Bu, because he hasn't come up here and said anything yet, because you had some very specific questions about testing. He's our expert. Come on up, Alex.
Yeah, thank you for that question and for reading the literature so closely. I think we've said before as well that while we are doing high numbers of tests in many parts of the state, we're not reaching everywhere that we want to reach. And I think that's part of what we're really trying to focus on right now. Is you can take a broad state level number and say you're testing this many people per 1,000, but what we're going to be really focused on is down to the regional level. How are we doing reaching various different populations? As you've heard the governor say and myself previously, we don't know what we aren't testing. We don't know what we don't know. And that's where we're focused. That's why we're trying to surge our ability to do more tests, but also not just to do more tests gross, but to be able to do them in areas like Hammond and other areas where maybe we're not seeing the volume of tests that we want to see. So we're going to be looking at different measures rather than just that, how many total tests per 1,000. We're really going to be trying to understand what are we doing to reach different proportions of the population across the state.
Well, we're not going to take this on a parish-by-parish basis. Caddo right now is testing positive about 6 or 7%. So they would sort of qualify for WHO right now. But Orleans, obviously Jefferson, and even Baton Rouge is 16, 17%.
So we talk a lot about the public health regions across the state, and one of the reasons that we broke them up that way in public health is that almost all of them have a major urban center or sort of a population center in each one of them. What we're really leaning into is more of a hub and spoke model. So it doesn't mean that each parish is going to have one of these high throughput machines doing tons and tons of tests, especially if they don't have the population to drive it. What we want, though, is specimen collection to be happening in all of those parishes, and then probably coming back to these population centers where we know these high throughput, big machines that can run large numbers, like the ones in Caddo. And it's worth noting that right now, that LSU Shreveport lab is running tests for most of Region 7, most of the area around Bossier and Caddo parishes, but they're also doing samples because of EA Conway over into the Ouachita area in the Northwest. So they've already got a bit of that model going on. That's why you see such large volumes being reported there. That's also one of the reasons that we're talking about retooling the way that we report that data so that you get more of that in. When you're looking at the dashboard, you'll have a better sense of where is the testing, where are the people who are being tested located, rather than where is that testing happening.
Can I ask while you're still up here though, do you have a timeline for when you think you'll get to, when you think the state will get to 140 to 150,000 tests done per month? And can you talk about what the biggest challenge is? Is it manpower? Is it getting the testing kits? Is it something else?
To the first one, we're aiming to have that by the end of May. Really, to have the month of May be one where we achieve that target. It's a moving target on what's the problem, and I'll note that that's been true since the beginning. Right? Initially it was CDC testing, getting those to the labs. Then could we validate them, and so on. Right now, one of the major limitations has been those specimen collection swabs. We've been using a variety of different swabs, and we're actually coordinating, again, across labs across the state to think of different ways that we can get different swabs, including the team up in Shreveport 3D printing swabs. And then can we validate those as a way to be able to access it? There's also the transport media. You've heard a lot about that in the news. That's the liquid, that little pink liquid that you see the swabs go into. Fortunately, we've had 2 labs in the state start to produce their own, including the LSU Vet School lab here, and we're looking to expand that. And then there's all the different reagents, the components that the various testing machines we have need to be able to process that test. There we've seen the federal government and private sector really put a lot of push into getting those components ramped up, and so we're hoping that right now that's not a bottleneck for us and that it won't be one in the future. But that first step, getting that specimen from somebody, is one of our major limitations.
And manpower-wise, is that been a challenge, or you'll find on that front?
I think we've been able to leverage. Keep in mind, we've seen lower visitation to our community health centers. We have one of the largest, nation's largest networks of federally qualified health centers. And so all of those clinics, as we've reached out in the Florida, or rather in the river parishes or in the Northwest, to ask where can we do community-based testing, it's usually those federally qualified health centers that have stood up and said, we're ready we serve this community 365 days a year. This is a way for us to serve. So person power doesn't seem to be a problem right now.
To the first one, is this the elective surgeries? Will this is this going to kind of start to transition to that new kind of executive order that you're going to be signing soon, where possibly we could see maybe gyms or possibly salons and nail places? Could those start to come out, begin to open up starting in May, something like that? That's the first question. Then, are we doing a good enough job at staying home and not making non-essential trips?
Well, the second one I'll take first. You know, it appears to me, and this is mostly anecdotal because it's not showing up in spikes in cases yet, and I hope it doesn't. But it seems to me that starting around Easter weekend, that people have been traveling more and engaging more with one another and having more contact. I hope that's not the case, and if it is the case, I hope it doesn't translate into having the cases that I'm afraid that we might have. But if I'm right, it's just a few more days before we're going to see those case numbers start to spike. But what I do know is we can all do better, and we should all be focused on the task at hand, which is continuing to slow the spread, making sure that we're doing what the president has asked, or what we have asked here in Louisiana, what I have asked, and that is that we stay home unless it's absolutely essential that you get out. When you do that, you do it no more frequently than is absolutely necessary. You don't take the entire family. You practice social distancing. You keep your mask on when you're going to be in close proximity to others. You watch your hygiene. You stay home when you're sick. All of those sorts of things. Those things are still critically important, and that's what I need people to be focused on. Now, it is obviously the case as you transition into reopening the economy, then you, at some point, and under circumstances that aren't necessarily fully defined yet, you reopen different types of businesses, including barbershops and nail salons and those sort of, where they come in and when that's going to happen. I just can't tell you that today. Obviously, I want to do it as soon as we can, consistent with public health imperatives and saving people's lives. And when that happens, they too are probably not going to operate the way they always have. That you won't have people in the waiting area sitting close to one another. You're going to have people wearing PPE, especially masks, and you're going to see all sorts of hygiene practices and sterilization efforts and all of these sorts of things in order to be able to transition to that. But when it happens, you know, it will obviously happen. I just don't know when that's going to be yet. Yes, sir.
Governor, late last week, the mayor of New Orleans said she doesn't see a scenario where large gatherings or festivals take place even this fall. Would you agree with that assessment? And then kind of under what scenario do you see the return of large gatherings or festivals?
Yeah, so I think it's too early for me to say that I have a crystal ball that offers me any glimpse into the future as far out as this fall and know what that looks like. I know what the task at hand is today, and that's what I prefer to focus on. When I speak and think about the future this fall, whatever, I tend to be more aspirational, but wanting to control expectations is that under no circumstances will this fall look like last fall, because we're not yet going to have a vaccine. I pray that we will have effective therapeutic treatments, which we don't have today. But until we have that vaccine, you are not going to have people acting just as they did last fall. And so what the football games look like, what the different gatherings look like, I don't know. But they're not going to look the same, because there's going to be some things that we're going to have to do differently in order to make sure that we're not unnecessarily spreading the virus, putting demands on our healthcare system, and you know, running up the death count. I mean, you just can't do that. But I don't sit here today and tell you I know exactly what that looks like, or that because of these concerns that I can't see under any circumstances that we would have large gatherings at some point this fall. You know, I'm just not there yet.
Last one.
Governor, there's been a national outcry over nursing home deaths that has spiked in recent days, and some states with reversed their policies have started naming these nursing homes. Is your administration going to name the nursing homes now that we're nearing half of all nursing homes having coronavirus there?
I don't know. I don't know.
It wouldn't be our recommendation to change it.
And Jeff, you've been patient back there. I don't think I've called on you today.
Has your Resilient Louisiana Commission met yet? Do you have any idea on when they might be?
I know that we have had some phone calls. I mean, we just named it last week, right?
Right.
At the end of last week. And so I know that there have been preparatory phone calls. We've done that. I'm expecting to have a phone call with them later this week to personally give them my charge as to what I want them working on and over what time frame, and then reporting back to us so that we can have the most deliberate, best plan possible for re-engaging all the sectors of our economy and getting everybody back to work and all of our businesses back open as soon as we possibly can, while we continue to promote public health and stop the spread of this virus. Now, so I will be having that call. And by the way, when you say meet, this is part of the new normal too. Their meetings are going to largely be over Zoom,
Right.
and that sort of thing. So I don't expect that the entire task force is going to ever, maybe I shouldn't say ever, not anytime soon, come together for a personal meeting, all in the same physical space. But they will be having a phone call with me later this week, in addition to the phone calls that happened last week as well. So tomorrow we will have this press briefing at 2:30 p.m. And again, I want to thank all of you for being here. And I urge the media folks in the room and the people at home, don't get so distracted about what or might not happen, might or might not happen a month from now, 6 months from now, that you lose sight of what the task is right now. And that is to continue to slow the spread, keep us on this trajectory, because if we don't do that, we don't get to phase one. You know, we've got to do what we have to do to slow the spread, save lives, practice social distancing and good hygiene, and let's work together. Let's continue to be focused. Let's continue to be patient. Let's do what is required of us. We obviously know it works. A little over a month ago, we were here telling you that we had the fastest case growth in the world of COVID-19. And for the last week, we've been telling you that we're trending in a good direction, and so forth. So we know this works. We have to continue to practice it, and then we're going to make it through this just as quickly as we can, but not quick, and in the best possible shape. That's what's going to happen. And I know the people of Louisiana are resilient people, and so forth. But we got to get through this together, and I assure you that we will. Thank you.